Functional and integrative counseling. Let me explain. If they're just performing a workshop for a ton of people who are held hostage by symptoms of trauma, that's number one. Stress, number two. And lastly, the inability to follow through with their intents. They have great intentions and bad follow through. So they're underachieving relative maybe to their ability. After having a whole audience of these people, almost all of them are going for treatment. They're seeing a doctor, a therapist, a psychologist, psychiatrist, somebody to try to get them well. And the one thing that they all had in common, which was inspired me to do this video, is that they really didn't understand, and I mean really hardly anybody understood the nature of the insult that they were suffering. So for example, stress. Number of people who were suffering stress really didn't understand what stress meant, from the least impactful, which would be, hey, you have an overwhelming schedule, but it was the most relatable, to the most impactful, which was oxidative stress, where you're on a biomolecular level, your body is damaged in the mitochondria. So as I'm presenting what all this means, all these eyes were opening up. People were like, man, I just can't believe it. And the hands are flying. Why is that? Well, how does that work? Why don't I know this? So as clinicians, or could be physicians, therapists, or alike, I highly recommend using the cognitive behavior model that has been around for years. I take it a step further. I call it the functional and integrative model, which is my own model that I've created several years ago, which is teaching people how and why your brain functions the way it does. The integrative is how that insult or dysfunction of what should be functioning interferes or is coordinated with other parts of your body in an integrative sense. And then lastly, the behavioral piece is, how does that manifest into your performance? When we educate people as to the nature of their illness, of their insult, of their disability, of their disadvantage, of their dilemma, whatever you would like to call that, it allows for our clients to actually be able to make decisions that are proactive and reactive, but either way responsible on their own. So I'm going to give you an example of this. So with one person, and there were many that could relate, suffered really bad trauma from a childhood experience. Someone died, it was horrific, and the person had been seeking help for evidently like 2 or 3 decades. And the one thing that the person was surprised is that it's not that it's impossible, but it was very hard for this person to understand, why can't this person just change their mindset and not suffer the trauma that happened in the past? When I talked about how the limbic system works and how the amygdala in the subcortical area, to include that limbic system, stores these not stressful memories, but distressing memories, and how that gets locked and loaded, or we use the word encoded, not only in the amygdala, but activates the AMPAR, A-M-P-A-R, AMPAR receptor, to then be suspicious and look for signs and signals of material or details in a person's everyday life that reminds the person of what the insult was that was so distressing and traumatic from 30 years ago. The person said to me, I can't believe this happens every day. I go through this every single day. With certain people, creates suspicion, that I get paranoid and I'm ramped up, and oh my God, so how do I change my mindset? And I said, well, we're talking about a physical structure in the brain that needs, often physical intervention. And here's what we would do for that. And other people had their hands up, like, I just didn't understand that. Now it makes sense. So the point that I want to make to everybody is, whether you're receiving counseling or you're the deliverer of counseling, educating our clients as to what's wrong, how it impacts a person's ability or inability to function, how the insult is collaborated or associated with other functions in the body, and how it then manifests into one's performance, whether they can't perform or they're not performing well enough or they're performing in a way that is not congruent to one's potential or goals that they set to achieve is so critical, because otherwise our clients, or even if you're the person suffering, would become like puppies. We just wait for people to give us direction, like sit down. So we sit, but we don't understand why we're sitting. We don't understand how to sit on our own. Our goal as clinicians always has to be to build the tools, the techniques, and the knowledge for our clients so they don't depend on us. We want them to, hopefully sooner than later, become independent. We don't want our clients dependent on us. So we have to give them this repertoire of tools, or arsenal of tools for independence. And lastly, and in closing, when that information is understood by our client, we want to learn back, which means we ask our clients, explain to me what you know, because the only true measure of mastery is one's ability to teach what was taught. So if our clients can't teach it back to us or teach to another within our observation, we are not certain that a person really has the ability to be independent with what we in fact taught them. And memorization doesn't count. So just the fact that someone can just restate what we said is not good enough. They have to be able to generalize that multiple environments, multiple situations, at multiple times in their life. So I hope this is helpful for everybody, whether you're a patient or a practitioner, but use my model, functional integrative counseling, and I'm hoping that everyone will benefit.